Assalamu alaikum, welcome to Medical Globe e-learning. Today we are going to discuss joints of the upper limb from 7th edition KLM. Let's move forward. First we have here the sternoclavicular joint. This joint is very important for MCQs, Viva, and UQ as well. Then if you talk about the articulation, is again important. You don't have to go for the detail of the joint capsule. Then we have the ligaments. You have to memorize the names of the ligaments. Okay. These movements, the degree of movements they perform do come in MCQs sometimes, so please give it a proper read. Then we have here nerve supply and the blood supply of sternoclavicular joint. These are not that important, but you have to do these. Then we have the acromioclavicular joint. Again, the articulation, the joint capsule, not in detail. Then we have the ligaments, names are enough. Then same goes for the blood and the nerve supply. Then is the glenohumeral joint. Okay, there's a question asked usually how stability of the glenohumeral joint is maintained. So you have to answer this. It is a UQ as well. Then the articulation again. You don't have to go for the detail of the joint capsule. Then we have ligaments of the glenohumeral joint. Okay, just do learn the detail of ligaments of this joint because it's important. Sometimes the details are asked. Then we have movements of the glenohumeral joint. Again, movements are very important for the UQs. Then muscles moving the glenohumeral joint. This is a UQ. This is important in the blood supply and is again important. Then we have the innervation. Okay, you have to learn the names of the bursas around the joint. Then we have elbow joint. Again, elbow joint is very important for the MCQs, Viva and SCQs. Then again you have to learn the articulation. Then you should know the joint capsule. Then you should know the ligaments. Names are enough. This table is not that important, but you should know the movement and the prime movers are important. Just you don't have to go for synergists and notes. No, don't do them. Then we are again the movement of the elbow joints are important. And the carrying angle, sometimes mostly in Viva a question is asked regarding the carrying angle. So you should know the carrying angle, its definition, and what is the angle in males and what is the carrying angle in females. Then muscles which provide movement at the elbow joint are again important. Then, okay, if you talk about the bursa of the elbow joints, only names are enough, because the names are mostly telling the locations of their bursa. Okay, the proximal radioulnar joint, again, it's important. Its articulation is important. Its joint capsule, don't go for the detail. Then the ligaments, the names of the ligaments are to be done. Then movements. Okay, the supination and pronation are frequently asked in Viva, so you should learn this, and it's also a UQ. Then moving forward, we have the muscles moving the proximal radioulnar joint. You should know the muscles which are providing the movements. Then blood supply and nerve supply, you have to do these. They're not that important. The distal radioulnar joints are just you have to do all the things again. Articulation is important. Then we have the joint capsule. Then the ligaments, name of the ligaments, movements again important. And the muscles which are providing the movements, blood supply and nerve supply is also important. Like you should know that. Okay, wrist joint is very important joint for the UQ, Viva and SCQs. MCQs do come in the exam that the wrist joint is the ellipsoid type of the synovial joint. It is a very famous MCQ, frequently asked. Then we have the articulation again. Articulation is important. Joint capsule is important. Ligaments are important. Names do come in exams. Then movements of wrist joints are very important. They're usually asked in Viva. And the teacher do ask them to show them the movements with your hands and breast. Then we have the blood supply and the innervation. Okay. Let me tell you one thing, the small joints, especially of the joints of the fingers, are not that important as compared to the major joints of the upper limb, like the shoulder joint, the elbow joint are important as compared to these small joints of fingers. Again, intercarpal joint, just do the joints superficially, just don't go for the detail, and it's more than enough. Then there's intercarpal joints. Then we have, you should learn the ligaments and the movements, and that's enough. Then again, same goes for the carpal, metacarpal and intercarpal joints. Then we are done. Okay, now we have the clinicals. Clinicals of joints are very important. Scenario-based questions do come from here. And here we have the dislocation of sternoclavicular joint, very famous for scenario-based SCQ. Then we have the dislocation of acromioclavicular joint, again famous SCQ. Okay, then we have the rotator cuff injuries. This is an important clinical. Then axillary nerve injury is an important clinical. Then glenoid labrum tears are important. I have marked the important clinicals, and the other unmarked clinicals are not very important, but it's okay to give them a read because these blue boxes are important. Then we have bursitis of the elbow. Okay, now we have dislocation of the elbow joint is again important for the scenario-based SCQ. Avulsion of medial epicondyle is important. Then we have ulnar collateral ligaments reconstruction. Just give it a read because scenario-based question do come like how from where the ulnar collateral ligaments are torn from. If injury to the ligament occurs, what happens? These type of questions do come. So just give it a read. Then we have the subluxation and dislocation of radial head. This clinical, you have to do this clinical. Then wrist fractures and dislocation, you have to. Okay, these two clinical, Skyer's thumb and Blue Rider's thumbs are very famous and very important. And we are done with the marking of the joints. I hope you understand. Please consult MBBS crack books for best quality SCQs and MCQs. Thank you, and Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.